Hey everybody, it's Caitlin. Welcome back to CoronaChat. Today is Wednesday, April 8th, and many of you have been asking about social distancing, so that's what we're going to focus on today. So it seems like everybody these days is talking about social distancing, right? But if you're anything like me, it's kind of hard to tell exactly what that means. Do we just have to stay 6 feet apart from each other or wear a face mask in public? And what if we create like isolation pods or groups of friends that just isolate from everybody else except for each other? This can be kind of confusing, so let's go back to the beginning, right? We know the virus spreads through close contact, from shaking hands, hugging, or being too close to somebody who's coughing or sneezing. And the virus can also last for some time on hard surfaces, things like metal or plastic. Now, there have been some reports that small aerosolized particles can hang around in the air for a while in laboratory settings. But as far as we can tell in the real world, it's mostly this close contact and these high-touch surfaces that we have to worry about. And what we're trying to do through social distancing is cut off the ability of the virus to jump from one person to another, right? So if we do social distancing really well, we can stop the virus in its tracks. But we all have to pull together and do this. And right now, the recommendations for social distancing are to stay home as much as possible. You really want to limit the contact that you're having with other human beings as much as you possibly can. This is because people who are infected are contagious well before they have symptoms, so we can't tell who's sick just by looking at them. And more to the point, we can't tell if an infected person has touched a doorknob before we do, meaning that there's virus particles lingering there, right? So the best and safest thing to do if you're healthy is to stay home as much as possible to limit the chance that you come into contact with the virus. If you do have to go out to get groceries or to pick up medication or because you have an essential job, make sure that you put on a face mask first. Remember, over your mouth and your nose, and make as tight of a seal against your face as you can, against your nose, cheeks, and then down on the sides of your face and underneath your neck, right? And once you've set it, forget. Don't take it off until you're back home. And make sure to wash your hands before you take it off. So wash the hands, take off the mask, throw it out or put it straight into the laundry, and then go wash your hands again before you do anything else. So what about the 6 feet thing? Our best understanding right now is that the virus spreads through this close contact, right? So that's why we're recommending having at least 6 feet of distance between you and the next person. And quick note, that's 6 feet on either side of you, right? So I'm seeing some boxes taped off on the sidewalk that are 6 feet total, but that means you're only 3 feet away from the person who's standing outside the box, right? So we want 6 feet between you on every side. So if you and the person standing next to you raise your arms, if your arms are touching, you're too close, okay? Now, that's because the recommendation is a minimum of 6 feet. You want to be at least 6 feet apart from one another. And ideally, you're putting more than 6 feet between you and the next person, and also wearing a mask. So having wine outside with the neighbors and making sure your chairs are 6 feet apart is probably not good enough. I'm sorry. I know you don't want to hear that. But, pick up the phone, schedule a video chat. Social distancing doesn't mean that we have to be isolated. It just means that we have to use technology to contact one another instead. Okay, so lastly, let's talk about this idea of isolation pods or pandemic pods, right? Some people have been talking about creating groups of people who quarantine from everybody but each other. This way they can still hang out in person and have human contact. This sounds like a good idea in theory, but in practice it's still pretty risky. This is because if you all live in different places, you still have to travel to get to one another. And every door that you have to open, every ride on public transit or even on a ride share is another chance that you're exposing yourself to the virus. And if one of you picks up the virus in transit and no one in the group is taking precautions because you're all in this pod together, you are all at risk. So virtual socializing is really the way to go right now. I know this is hard and it's isolating, so we have to make sure that we're reaching out virtually to all of our loved ones and checking in on each other, right? So send a text, pick up the phone, let your loved ones know that you're there. If we do this well, we can stop the spread of the virus. And last off, a piece of good news. This morning, the Institute for Health Metrics and Evaluation at the University of Washington, they're the ones running the big models of what's going on with the peak. They released their updated results today, and they show that our social distancing is working. We've managed to flatten the curve all over the country, and And in some states, the projections show that we're flattening the curve enough to make sure that there are enough hospital beds available for everybody who might need them if they get sick. This is huge. We can do this, guys. Love you all. Stay safe out there and take care of each other. We're in this together.